And welcome back to Comcast Newsmakers. I'm Steve Swat. My guest this segment is Micah Weinberg, PhD, who's a Senior Policy Advisor for the Bay Area Council. Thanks for being with us.
Thanks for having me.
And you advise on healthcare issues.
Absolutely.
And you're working with businesses. And the Bay Area Council is a group of business organizations.
Yeah, it's a group of the 300 largest businesses in the broader Bay Area, so from Oakland, San Francisco, and San Jose.
So I guess one of your jobs is trying to figure out how to increase access to care while keeping costs relatively low, or keep them from going up.
Right, and improve the health of Californians. So that small task.
Yeah.
Businesses care a tremendous amount about their employees. They also care a tremendous amount about their bottom line. And so the real challenge is making sure that you control healthcare costs in a way that doesn't make, that keeps your workforce healthy, in a way that keeps your communities good places to live and have a solid economy. So it's a huge challenge.
A number of years ago, there was a measure, actually it was on the ballot, and that dealt with expanding healthcare costs, healthcare, universal healthcare, but businesses really fought that.
Yeah, I mean, businesses really want it to be a market-based solution, and a lot of elements of the Affordable Care Act are very market-based. They have, some concerns, but ultimately, getting universal health care through the best means possible is very good for businesses, because it means that they have healthy workers and a productive workforce. And if you can figure out a way to produce health more efficiently, keep people healthier at a lower cost, that's really important for businesses, because they're spending thousands of dollars more than their international competitors to pay for the health insurance for their employees.
Of course, supposedly the Supreme Court already has decided on the Affordable Care Act. They just haven't told us yet.
Yeah.
They will. But the key, obviously, is the mandate.
Yeah.
Because without the mandate, then the cost is too exorbitant.
Right.
Correct.
So the reason why we have an individual mandate is because we need everybody in the pool. If you're going to require all insurers to cover all people, you have to make sure that all people come. Otherwise, only the sick will buy health insurance policies, and the cost will be astronomical. And that's why we constructed this reform in the way that we did. It's a market-based reform, and no one knows what the Supreme Court is going to do. In spite of the Sacramento connection for Justice Kennedy, I mean, we're really here at the center of it. Nobody yet has broken into his house and read his personal diary, so we have no idea what's going to happen.
But it was a pretty grueling discussion, shall we say, during those 3 days of debate before the Supreme Court that have led a lot of people to believe that this thing may be going down.
Yeah, well, the interesting thing is it was grueling and really broad, because it talked about not only the individual mandate, not only the insurance market reforms, but the ability of government to do things such as require states to have Medicaid programs. So the ruling that the Supreme Court could hand down could have much broader consequences than just this individual law.
If they save some portions of the law,
right,
but then strike down, let us say, the mandate,
right,
does that basically mean for you that it's just unworkable?
Yeah, I mean, people who want to see a market-based system for healthcare need to be very careful about doing away with the mandate, because the mandate is the glue in the market-based private health insurance system. There are other ways to do it. Not every country needs a mandate. Some countries have single-payer systems. But to the extent that we're interested in more of a private market system, that's one of the approaches we could take. There are other approaches.
What about an option out? An opt-out
Yeah.
that would allow California, for example, to stay in, but other states, if they want, can opt out.
Yeah, I mean, the difficulty there is that along with the mandate comes a lot of federal funds for subsidies for people to purchase private insurance. So I don't see a lot of people walking away from the hundreds of millions of dollars that their citizens would get, or being happy that one state could get them and another state wouldn't.
All right, well, we're out of time, but Micah Weinberg, thanks for coming by and talking about this critical issue, and we'll know pretty soon which way it's going to go.
Great, thank you so much.
Thank you again, and thanks to our viewers for watching Comcast Newsmakers. We'll see you next time.